Good morning. Senate Health, Education, Labor, and Pensions Committee will please come to order. Today we are having a hearing on the fentanyl crisis that is devastating our communities. I will have an opening statement followed by Senator Cassidy. And then we will introduce our witnesses. After they give their testimony, senators will each have 5 minutes for a round of questions. And again, while we're unable to have this hearing fully open to the public or media for in-person attendance, live video is available on the committee website at help.senate.gov. If you're in need of accommodations, including closed captioning, please reach out to the committee or the Office of Congressional Accessibility Services. Last week, back in Washington State, King County declared fentanyl a public health crisis, and it is painfully obvious why. This year, King County alone has lost over 270 people to fentanyl overdoses. That is an increase of nearly 50% from last year. That's more than one fentanyl death every day, and that's just one county in my state, one corner of our country, which lost over 100,000 people to drug overdoses last year. That is an all-time high. And that number doesn't just represent a grim record, it represents so many personal tragedies, so many families that are shattered by the loss of a loved one, parents, caregivers, and increasingly teenagers. Now, there's no question we had a mental health and substance use disorder crisis on our hands before the COVID pandemic. But there's also no doubt things have gotten so much worse due to the trauma of this pandemic, and so much more deadly with the sharp rise of illicit fentanyl in recent years. That's because fentanyl is up to 50 times stronger than heroin and 100 times stronger than morphine. 2 milligrams can be a lethal dose. From April 2020 to 2021, synthetic opioids, mostly illicit fentanyl, were responsible for nearly 2/3 of all overdose deaths. And the recent rise in fentanyl overdose deaths has also reflected the painful systemic health inequities we still need to do so much to address. Black communities, as well as American Indian and Alaska Native communities, have suffered a higher increase in overdose deaths than other demographics. There's also been a deeply alarming rise in young people dying from overdoses. In 2019, over 250 teens died from illicit fentanyl. Last year, we lost almost 900. Think about that. Fentanyl deaths for teenagers more than tripled in 2 years. My heart goes out to every family touched by this crisis, and I've heard from many of them. People who lost a loved one after a long, hard struggle with addiction, and those who lost a loved one suddenly to a counterfeit pill laced with a lethal dose of fentanyl. Our communities are doing everything they can to fight this, but they need help from the federal government to stop these dangerous drugs at the source, cut off supply lines, and importantly, get these kids and their families the help they need. And the way we do that is to support families on the ground through robust public health efforts and better access to mental health and substance use disorder care. When it comes to cutting off the supply of fentanyl, FDA has been working to crack down on counterfeit drugs being sold online, something I want to see them continue making progress on to protect our youth. And the DEA is working to seize fentanyl-laced pills before they can end up in our kids' hands. I've been pressing President Biden on this the same way I pressed the Trump administration. And we are seizing more fentanyl-laced pills than ever before, and I appreciate the hard work that's going into that. Our law enforcement and first responders on the ground are really working to rise to this challenge to stop these deadly pills and save lives and ensure people can get the care they need. But when I talk to police officers or fire chiefs and first responders back in Washington State, it's clear we have a lot more to do to build on the progress we're making, cut off the supply lines that produce these dangerous drugs, and prevent them from ever reaching our communities. Drug trafficking is a serious problem, and that's why Democrats continue to work with Republicans to provide significant funding for border security and drug interdiction. But let's get one thing clear. We need to be taking this seriously and having real conversations about how we address the national threat of fentanyl use and supply, not playing politics, not scapegoating, not fear-mongering, not attacking refugees and immigrants with proposals that are based more on xenophobia than on what will actually work to keep people safe. That's not to say we cannot talk about accountability, especially for opioid manufacturers who fueled this crisis to line their pockets. There were enormous corporations that knew just how dangerous and addictive these products were and yet decided to ignore the risk for patients, market these pills aggressively, and flood our communities with opioids. We absolutely must hold these companies accountable for padding their profits at the expense of countless lives. Of course, stopping the supply of illicit fentanyl and holding companies accountable, which fueled the opioids crisis, is critical. But we really have to tackle this challenge from every angle possible. And with that in mind, we have a lot more work to do to help our communities get people the mental health and substance use disorder care they need. Right now, less than 10% of people who need substance use disorder treatment can get it. And care is even harder if you are Black or Hispanic or American Indian or Alaskan Native. The painful reality is that most people who died by overdose didn't get any substance use disorder treatment before they passed away. That is unacceptable. We need to do better. A big part of the problem is our mental health and substance use disorder workforce has been woefully overstretched and understaffed. I've said this before, but it's so important to understand if we're going to get our arms around this. Almost 130 million Americans live in areas with a mental health care provider shortage. Essentially, they don't even have one mental health care provider per 30,000 people. In Washington, our mental health care workforce is only able to meet 17% of our state's needs. If we're going to turn the tide in the fight against fentanyl, that's going to have to change. We cannot lose sight of the fact that a strong public health system and easy access to treatment for everyone are some of the most powerful tools in our arsenal. We need to make sure every community has a robust public health department with the data needed to track overdoses, stop spikes, and the ability to raise public awareness about rising threats like counterfeit drugs laced with fentanyl. And we need to support programs on the front lines in our communities that are focused on prevention, treatment, and recovery support. I've fought hard to invest in our communities to expand mental health and substance use disorder care through HRSA, which is helping build our mental health and substance use disorder workforce in our rural communities, through federal grants, which have helped set up dozens of new treatment centers across our states, and in the American Rescue Plan, which included critical funds for this work. But to talk to anyone on the front lines of this for 2 seconds and you'll understand we have a lot more to do. Talk to the fire chief in Seattle who told me a few months ago they respond to 4 overdoses every day. Talk with the University of Washington researcher who told me how 80% of people who could benefit from services to keep them alive can't access them. Talk with the nurse in Everett who told Secretary Becerra about how there are just not enough beds to get people treatment, and the mom who told them about how she lost her job, her house, and her child while she was struggling with fentanyl addiction. Talk to Jason Cockburn at the Second Chance Foundation in Everett, who's spoken about the challenge of trying to get kids the treatment they need, or the many people who desperately tried to help him find an open treatment bed for a 15-year-old earlier this year, calling contacts, posting to Facebook, all to no avail. It's so clear that leaders like Jason, who are on the front lines of this crisis, need so much more from our federal agencies and from this Congress, more when it comes to getting fentanyl off the streets and more when it comes to getting people the health care they need, which is why I'm as determined as ever to continue the progress Senator Burr and I are making on a bipartisan package on mental health and substance use disorder. We need to support the programs on the ground in our communities that are already doing life-saving work to identify people who are at risk and prevent substance use disorders in the first place, to get people treatment, and to support people in recovery. And we need new programs, especially when it comes to addressing the new challenges we are seeing with fentanyl and with heartbreaking increases in overdoses among young people. So I'm going to continue to press for us to advance as expansive as a package as possible, as quickly as possible. And I believe that we can do it because we've done it before. In 2016 and again in 2018, Democrats and Republicans worked together to pass some of the most comprehensive legislation to respond to the opioid crisis in our country's history. That has made a big difference. That legislation has undoubtedly saved lives. But I've traveled to just about every part of Washington State to talk about this crisis, from Everett to Seattle to Longview to the Tri-Cities to Spokane and more. And the challenges that we are dealing with today are not the same challenges we faced in 2018. So now it is on all of us to build on the bipartisan progress we've made, and it's painfully clear our communities cannot wait. They need us to meet this moment with serious action and life-saving support for families.